Thank you very much, and thank you for having me today, Charlotte and Laura. So my name is Neve Keane, and I'm the manager for Norfolk SENDIASS. I have been the manager for 2.5 years now, but I've worked at Norfolk SENDIASS for 7.5 years in various different roles, front facing. Oh, if we could just make sure everyone's on mute. Sorry, thank you. So I have been the manager for 2.5 years, but prior to that I had front-facing roles within the service. So I was the independent supporter, which meant that I supported parents in applying for EHC needs assessments, going through the EHCP process, and also converting them, supporting parents to convert statements of SEN to EHCPs when the new law came in 2014. I was also the caseworker and the training and development officer as well. And I worked on the helpline, and now I am the manager and I do a bit of everything really. So I'm here to do the training for you. Prior to working at SENDIASS, I worked in a mainstream high school as a one-to-one teaching assistant and personal medical assistant. I supported a young person who had very complex medical needs, including a tracheotomy and a gastrostomy, and I was her medical professional and her teaching assistant. And I also worked at the Hamlet Centre. If anyone is aware of the Hamlet Centre, I worked in the children's service there. That's a little bit about me. We're going to move on now. If my slides would let me, bear with me. There we go. So just a few reminders for today's presentation. So be present, please listen to what I'm saying and what any of your colleagues in the room are talking about, any questions, because it might be that as we go through today's training, I'm able to answer the question through today's training. So give focus to those that are talking. Please have your microphones off. If you have a question and you're happy to ask the question while it's being recorded, please raise your hand and I'll come to you as and when I get to you. If not, there will be a bit at the end, like Charlotte said, where it won't be recorded and you're free to ask any of those questions openly. I'm going to send the presentation out to Charlotte so that she can then send it to those that have been in attendance today, and you can have a copy of it. If there is anything personal to you as a person or a family that you're working with, please do save that until the non-recorded section, and also make sure that this stays confidential within this team, within this group today. I'm not able to discuss really individual circumstances with you just because of the time frame at the moment. It is only a 2-hour training and there's a lot to get through, so please make sure they're more generic type questions. And if you would like to discuss anything further in detail with us as a service, you can book an appointment to speak with us as a professional via our website, and speak with someone then about more specific circumstances. Equally, Charlotte will be sending out an evaluation form as well as the presentation, and both of us would really appreciate it if you could fill that in, because it really helps both of us. And for SENDIASS, it helps us to know what's working, what's not working, but also go back to commissioners and things and say, you know, there is a need, there is an appetite for this kind of training, and this support for professionals in Norfolk, and here's the evaluation forms that back that up. So it's really helps us to be able to evidence things. I think that's it from me, and Charlotte, unless Charlotte, you have anything else to say.
No, I think that's everything. You've covered everything. Yeah. Fantastic. Perfect. So you're welcome to get started.
Thank you. That's fantastic. The only other thing I will just say is that technology doesn't always do what we want it to do. So if I haven't ever before, but that doesn't mean that it won't happen today. But if I do get kicked out, or if I do lose connection or anything, I will be back with you. So please just bear with me for that. So some of the bits that we're going to cover in today's training. So what are EHCPs? Some Norfolk statistics to help you be aware. Stages of an EHCP application, the legal process throughout, support that you could provide to a young person, parent, carer in the process of looking at applying for an EHCP, or oh yeah, that's doubled up there, but in the process of applying for an EHC needs assessment, and the Q&A section at the end. Just out of interest, just through raising your hands, how many people in the room here have supported a family to apply for an EHC needs assessment, been through the process themselves, or know about the process? So if you could just press the raise your hand section just to see out of interest. Okay, a couple of people. So that's good. So hopefully this will either help you to understand more what the process is and fill in any gaps of your knowledge. And for those that haven't ever supported or don't really understand it, hopefully if you are ever needing to support someone in the future, you have this to refer back to. So fantastic. Thank you all very much. You can put your hands down now if you like, unless you have any questions. So who are Norfolk SENDIASS and what do we do? Again, just out of interest, does anyone in the room know who we are, ever spoken with us, ever used us, have any idea what we do at all? Is there anyone in the room? If you do, raise your hands, please, again. Be interesting to know if anyone in the room does know who we are. So a few people. Okay, perfect. So it's going up slowly, but there's a few people, so that's fantastic. Excellent. So Norfolk SENDIASS, and SENDIASS stands for Special Educational Need Disability Information Advice and Support Service. We are a free, confidential, impartial and arm's length statutory service that provides information and advice across all of Norfolk. Now, we're written into the Children and Families Act 2014 that every local authority must have an IASS, an Information Advice and Support Service, that provides information, advice and support on matters relating to special educational needs and disability. So every local authority must commission a SENDIASS, and they must be jointly commissioned across education, health and social care. But we are arm's length from all bodies. We are our own little bubble in the corner. And that is because we challenge, because basically we offer information, advice and support on what the law says. So that does mean that we challenge local authority and health and social care and school settings, places of learning. Sometimes we also have to manage expectations of parent carers and challenge parent carers as well. And because we're impartial, we don't take sides. We are very much in the middle, and we very much support whoever in the room needs to be supported, and offer sort of informal mediation to try and resolve problems without the need for escalation. But that doesn't mean it doesn't escalate. So at the moment, we are significantly supporting with tribunals. So tribunals for final EHCPs, because parent carers are wanting specialist placements for their child or young person. We are incredibly busy at the moment. We currently have a 5-week wait to speak with an advisor on our helpline, and we also have a waiting list for casework support. So there is a significant amount of need in Norfolk around special educational needs and disabilities, and I'm going to go on to a couple of stats in a little while. Throughout today's training, you might see some things that are underlined. That means that they're hyperlinked. So, for example, our website is hyperlinked there. And I would really, really recommend that you do have a look at our website, because we have loads of resources on there, videos on there, and we are going to be putting more webinar videos, more training videos on our website in the next couple of weeks, for parent carers and professionals to upskill them in what the law says around education in SEND. So as I said, we offer information, advice and support to children, young people and parent carers about special educational needs. And we go from 0 to 25 in regards to the age range. And you do not need a diagnosis to receive support from us. So that's sometimes a bit of a misconception and something that parents are told by other professionals. I'm going to go on to a little bit of diagnosis law in a minute. All our advisors are independently trained in SEND law and complete all 3 levels of IPSI legal training, and the legal training that we undertake is accredited by solicitors. So although we are not solicitors, we do undertake quite rigorous legal training to be able to give impartial legal advice to parent carers, children and young people. The training takes it can take up to 6 months for all 3 levels, and it is incredibly complicated, and the training that we undertake is bespoke for SENDIASSes. As a service, we only support those families that live in Norfolk. So if there is a child or a young person or a family that you're supporting that live in Suffolk, for example, but go to a Norfolk school, we wouldn't support that family. It would be Suffolk SENDIASS. We will only be able to support families that live in a Norfolk postcode. We also offer generic information and advice to professionals regarding SEND and health and social care where it impacts on education. And we have had a significant uptake in professionals contacting us in last year, asking for advice around EHCPs, SEND support, transport, things like that. So our remit is quite significant. Historically, pre-2014, we used to be called parent partnerships, and we would only do 5 to 19 and only education. And now we're 0 to 25 and we're education and health and social care where it impacts on education. So we have had to upskill quite significantly in being able to give all that information, advice and support to families. So that's kind of a whistle-stop tour of who we are and what we do. Just to add that we are managed, all SENDIASSes answer to the Information Advice and Support Service Network, who sit within the Council for Disabled Children and answer directly to the Department for Education. So although we are employed and funded through the local authorities, we don't answer to them, we answer to national, and we answer to our minimum standards that we have to comply with. But there is more information on our website, and if you really want to know any more about SENDIASSes, if you just Google SENDIASSes and CDC, so Council for Disabled Children, it will bring up our minimum standards and all the information you need there. So a few statistics for you. Now, I was really hoping, so there's some embargoed statistics that haven't gone out into the public domain yet, which I do have, but I'm not able to put on the slides and send out, but I can give you a gist of what they're saying. The hope was that they would be out by now, but they aren't as of yet, which is a bit of a pain. But I will try and give you some information and advice that hopefully will give you a flavour of what's going on in Norfolk at the moment. So these figures are from the JSNA, and these are from 22-23. So they are a bit out of date, but you'll be able to see where they were in 22-23 and where we are now in 23-24 when I give you a bit of a verbal update. So in 22-23, 16.9% of Norfolk children and young people have SEN, which is around 21,000 children and young people that have special educational needs in Norfolk. Norfolk has a higher percentage of children and young people with SEN than the national and regional average. Norfolk's SEN population is 16.2% of children and young people in state-funded schools, including primary, secondary and special, where nationally this is 15.4 and 14.8 regionally. So it's not a huge difference, but there is a difference. Overall, the SEN numbers have remained broadly consistent over the last 3 years, and Norfolk remains around 1% point above the national average. Generally, when considering state-funded schools, there is larger percentage of SEN CYP in primary compared to secondary, and the difference is present for local, regional and national. And it is estimated that 7.3% of children and young people have a disability, which equates to 13,225 individuals in Norfolk. But what I will say is that when we look at and I've not got that in the training today, but it's just a bit of useful information for you. When we look at the definition of a disability under the Equality Act 2010, the majority of children and young people that have special educational needs will fall under that definition, whether they have a diagnosis or not. But not every child in that 13,225 that have a disability will have special educational needs. So there is a difference where the majority of those with special educational needs have a disability, but not many of those with a disability have special educational needs. So when we are talking about children and young people with SEN, and when we look at reasonable adjustments and things, it is prudent and sensible to consider the Equality Act and disability discrimination for those children and young people that have special educational needs. So that's the sort of flavour as it was in 22-23. Currently in Norfolk, where we went from 21,000, we have surpassed that and then some. We now have around 27,000 children and young people with SEND in Norfolk, which is a 28.5% increase. And again, we are above the national average for the east of England, the region, and also nationally for those with EHCPs and those on SEND support. So again, we are significantly higher than the national and regional average for those that have EHCPs and those that have SEND support in schools. I say significantly, because I don't have the figures on me because I've got to be very, very careful, but I don't think it's too dissimilar actually to what the figures look like there, but they're just more now. The other thing to bear in mind, and I know we're not here to look at exclusions and suspensions and things along those lines, but those have gone up considerably as well. And there is a link between SEND support EHCPs and our children and young people with SEN being permanently excluded and fixed term suspended. We know that. And a figure that I heard yesterday was that in 2017 there was about 100 permanent exclusions a year, and as of now there's about 400 a year in Norfolk, so it's gone up 300 and quite considerably since 2017, and that is a catch-all. That will mean that there are some within that cohort that don't have SEND, but we as a service are seeing a significant rise in fixed term suspensions and permanent exclusions for children and young people that have SEN, primarily because schools are really struggling and nurseries and post-16 are really struggling to meet their needs, and so can't meet their needs, can't support the behaviour, and so they're being permanently excluded. That's a whole other training session to talk about exclusions. And if anyone is interested in knowing about exclusions, please do let Charlotte and Laura know, because it might be that we can do something again collaboratively on that in the future. But that is a whole other beast, and there is a lot that I could go on about that, but I won't. So those are some figures and facts there around just the percentage and sort of how high it is now and how much it's gone up, and it has gone up considerably, which kind of correlates with why our wait time is 5 weeks, why our referrals have gone up almost double, because there are more and more children and young people with SEND in Norfolk, and a significant portion of those nationally and in Norfolk are now under the age of 5, and that is probably and primarily due to the pandemic, and a lot of our children and young people that are sort of that age, under the age of 5, having to come back into a society or a situation where, you know, we're back to normal, so to speak, and they struggle with that. Any questions or anything based on the stats and data? I can see there's a lot of people in the comments saying yes, please, to exclusion training. So yeah, that's absolutely fine. Again, something that Charlotte and I can talk about at some point and look to offer if that is something that people would find really useful. But I can't see any questions around that, so I will move on. So before I can really talk to you about EHC needs assessments and EHCPs, I need to have a conversation with you about SEND support. And that's because when we look at the support that should be offered to children and young people with SEND, it's sort of like a pyramid. So at the bottom, you have your sort of ordinarily available, really good differentiation by school teaching staff, and things like that they should be doing as normal for children and young people, because not every child or young person will have SEN, but they might need their work differentiated for them to be able to, you know, move forward in education. And for some it will just be one subject rather than others. So for example, I always needed additional support in maths because I'm really terrible at maths, but everything else I was absolutely okay at. But that doesn't mean that it's SEN. That's the next level, that SEN and SEN support. And for those that need over and above what SEN support can provide at a school place of learning level, you then look at an EHCP and an EHC needs assessment. So the definition of special educational needs. So a child or young person has SEN if they have a learning difficulty or disability which calls for special educational provision to be made for him or her. A child of compulsory school age or a young person has a learning difficulty or disability if he or she has a significantly greater difficulty in learning than the majority of others of the same age and has a disability which prevents or hinders him or her from making use of facilities of a kind generally provided for others of the same age in mainstream schools or mainstream post-16 institutions. The biggest thing that I can say to you today, and it is still a myth that we hear on a weekly basis from parents and schools and professionals, is that you need a diagnosis to have special educational needs. And the law is very, very clear that you do not. If you are to receive special educational needs support, it is based on the need and not the diagnosis. The diagnosis is the umbrella term, and it's the need underneath what the child or young person struggles with is based on whether they receive SEN support or an EHC needs assessment, EHCP. Again, a diagnosis is not necessary for an EHCP or an EHC needs assessment. A diagnosis is also not necessary to be classed as having a disability, which is why you might have children and young people who don't have a diagnosis of SEN, don't have a diagnosis of disability, but will fall under both legal tests. Even without a diagnosis. So a diagnosis is absolutely not necessary. And it is something that I would really encourage you, if you work with schools or if you work with parent carers and you hear this, I would really encourage that you dispel, because it is something that we hear. And unfortunately, what we are hearing a lot of now is parents seeking private diagnoses and spending a significant amount of money because they are under the impression that their child needs a diagnosis to get any support in a place of learning. And unfortunately, that is rising nationally and in Norfolk. So if you do hear that, please do encourage whoever is saying that and let them know that it's not necessary. Just for those under 5, so if you're under compulsory school age, then hopefully everyone knows what compulsory school age is. But compulsory school age is the term after your 5th birthday until the last Friday in June in the year you turn 16. So for anyone that might not be aware, but post-16 is not compulsory education. I know there is a lot of emphasis on children and young people attending college and going to sixth form and continuing into further education, but it is not compulsory, unlike compulsory education, which is sort of term after your 5th birthday to the last Friday in June of the year you turn 16. But for those under compulsory school age, if they are likely to fall within this category once they are of compulsory school age, then they will be deemed as having special educational needs. Any questions at that point? I can't see any hands up, so that's fine. Great. So when we look back at the definition, it is quite vague. And then what we do is we look to the SEN Code of Practice, which is there is a framework of SEND law, and it's a bit like a skeleton. Your Children and Families Act is your skeleton, it's your bones. Your SEND regs, which give you your timescales, your time frames, etc. Timescales and time frames. That's your sort of, fat and tendons and muscles and all of that. And then your SEN Code of Practice is your skin, your hair, all your other bits that make you into a human. And the SEN Code of Practice goes into further detail and far more detail than the other two pieces of information. The difference, though, is that the Children and Families Act is legislation, it is law, whereas the SEN Code of Practice is statutory guidance. But statutory guidance, although it doesn't have the same sort of weight as legislation, the Children and Families Act, it is expected to be complied with unless there is a very good legal reason not to. And as of 2024, and the SEN Code of Practice has been out since 2015, there has been no case law to show or prove what a good reason not to comply with the SEND code of practice is, which means that it is very unusual and something we've not heard of yet is it not being followed. Well, actually, I'll rephrase that. We know the SEND code of practice isn't always being followed, but there is no reason as to sort of say why it shouldn't be followed. So within the SEND code of practice, there are 4 areas of need. That's communication and interaction, cognition and learning, social, emotional, mental health, sensory and or physical. A child's special educational needs might fall under all 4 of these areas. It might only fall under 1, it might only fall under 2. But these give an overview of the range of needs that should be planned for by places of learning. What we are hearing a lot of is that a lot of places of learning don't consider mental health or social emotional mental health to be a special educational need. And it absolutely is. If it is impacting on education, impacting on learning, impacting on that child or young person, then it is absolutely a special educational need, needs to be planned for and supported. That's really important. So when we look at a child or young person with autism, for example, it's likely that they will fall under all 4 categories of need, and they need to be planned for by the school. So within sensory and physical, it might be sensory needs along the lines of struggling with sound, struggling with bright light, struggling with the feel of certain school uniform. Social, emotional, mental health might be that they are an emotionally based school avoider, they have anxiety, they struggle to make friends, they struggle with their behaviour sometimes when they become overwhelmed. Cognition and learning might be around they're behind in all their education, and communication and interaction means that they struggle to communicate and interact with others around them. A lot of people presume and believe that to have special educational needs and to need an EHCP, that you need to be behind educationally and fall under the cognition and learning banner, and that is not correct. So we hear it from schools all the time, and places of learning and parents, so they'll say, well, actually the child is keeping up educationally, so they don't need an EHCP or they don't need SEND support, and that is not the case. It could be that their social, emotional, mental health is significantly impacted and affected, and they are starting to school refuse. And actually, if support isn't provided now, then their grades, their cognition and learning will start to go down. Equally, sensory needs, communication and interaction. It's looking at the child and young person as a whole person, in a holistic way, not just at whether they're behind in their academic subjects. That doesn't necessarily mean just because they're doing really, really well in school that they don't need an EHCP or SEND support. So what is SEND support? It's a process by which a child or young person with SEN is given special educational provision to help them access education. It's called a 4-part cycle, or you might hear it called APDR, which is assess, plan, do, review. But generally it's called the 4-part cycle or the graduated approach. And it starts with assess, so assessing and collecting information about the needs of the child and young person, from professionals such as progress, attainment, ability, behaviour, then seeing if that child needs additional support and writing it into a SEND support plan, which consists of the support, the expected progress, and review date. Then the teacher or the tutor, whoever it is, the SENCO, will put that plan into place, and then that plan should be reviewed. Really, we say termly. The SEND code of practice says that schools, places of learning, should meet with parents 3 times a year, which is around once a term, to look at the SEND support plan and review it and see if it needs amending. And that process can happen as many times as it needs to throughout a child or young person's educational career. But this is really important to know, because it might be that when you are supporting children and young people or families, actually the conversation is that the school needs to do more and provide more SEND support and put more funding in or seek funding from the local authority, rather than an EHC needs assessment. So educational placements, duties and responsibilities regarding SEN. So there's something called the Best Endeavours Duty, which comes from Section 41 of the Children and Families Act, which is legislation. And it states that they must use their best endeavours to make sure that a child or young person with SEN gets the support they need. This means doing everything they can to meet children and young people's SEN. And the best endeavours duty is what we call a high bar in law. It would be really difficult to show and prove why you are not able to provide that child or young person with SEN support. And schools have options available to them. They can go to the local authority and ask for additional funding. You don't need an EHCP for that. A child can be on SEN support and receive additional funding. I won't get into it in huge amounts of detail, but there are lots of things schools and places of learning can do to ensure that they are complying with their best endeavours duty. It is a proactive duty that requires the appropriate authority to inquire and ensure that the nursery, school or college is making special educational provision that children and young people require, and the best endeavours can require school or other settings to obtain specialist help. So if we go back a slide to the assess, plan, do, review, at that assess stage, if the school are really struggling with pinpointing what the needs of that child and young person are, under the best endeavours duty, they should be seeking advice from further professionals, so an educational psychologist, an occupational therapist, speech and language therapist, etc., to really pinpoint what those needs are. And in regards to the appropriate authority, that is the governors or trustees or proprietors of that school, college, sixth form, academy, whatever. That is who that appropriate authority is, not the head teacher, not the SENCO. It is those sort of higher up. So funding. The schools block is the main budget for mainstream schools, and the schools block is made of element 1 per pupil funding, and this is used by individual schools to support all pupils. And it includes those that have SEN, and most of the time that kind of funding goes on staff, equipment, upkeep of the school, things along those lines. Element 2 is your SEN specific funding, and this is for schools to spend directly on special educational provision. It is not ring fenced per child with SEN, because some children with SEN might only need £100 of funding spent on them. Some children with SEN might need 6,000, 10,000 of funding spent on them to support them. So it is not ring fenced, and it is not a specific amount per pupil, but notionally the government have said it should be around 6,000 per pupil with SEN. Schools should use their SEN funding to meet the needs of the cohort of children and young people. And it does say schools and academies should have sufficient funding in their delegated SEN funding budget to enable them to support pupils' SEND where required. But we do know that there has been significant cuts to schools and other places of learning over the last year, really. Where individual pupils require additional support that costs more than the notional funding of 6,000, the extra cost should be met by requesting element 3 funding for the individual pupil, and that is through the local authority, and an EHCP is not necessary to receive that higher level of funding and support, and there is a link there should anyone want to have a look at that. I think there is something that's just come in the chat, so I'm just going to have a quick look at it. I run external alternative provision. I'm being told from September no EHCP means schools won't get funding to attend external alternative provision. That's not the case. No, absolutely not. They do not need an EHCP to attend external alternative provision. That has to come out of the school's SEN funding, and if it's more than what that SEN funding and notional funding is per child, then they need to seek additional funding. So say, for example, it's going to cost 8,000 for that child to go to an external alternative provision. For they will need to make up the cost, and where they cannot make up the additional cost and can evidence that, they need to seek that additional funding from the local authority, regardless of whether there's an EHCP in place or not. But if you want to discuss that in greater detail, please do come back to us. Hang on, bear with me. My screen has, there we go. So where despite the school having taken relevant and purposeful action to identify and meet the needs of the pupil is still not making expected progress. And remember, that can be across any of the 4 areas of need, not just cognition and learning. The school should consider requesting an EHC needs assessment. And this is where we're going to get into EHCPs now. So there is going to be a lot of legal tests that I'm going to talk to you. Please do, when you get this these slides, do go back and have a little look over them. It is going to be quite brief because I could spend half a day, a full day with you going through sort of the real in-depth of the EHCP. So this is more of an overview rather than a really in-depth, but hopefully that will give you enough to be able to move forward and support families. So what is an EHCP? An EHCP is a legal document for children and young people aged up to 25 who need more support than is available through typical SEN support. But a caveat I would add to that is that some children and young people will have needs that are such that actually an EHC needs assessment should not, you should not wait to apply for one. So if they have had an accident or something has happened and all of a sudden they've got special educational needs and they need an EHCP to help them in education or to support them into a specialist provision, then it should not be waited on. The other caveat to add to that is that if a school or a place of learning still won't provide any SEN support, even after a lot of encouragement, a lot of support, additional funding, etc., and that child or young person is still without any additional support in school needed for their needs, the law is quite clear that that responsibility then does fall to the local authority and an EHC needs assessment should be applied for. So although we need to encourage schools more to put SEN support in place and provide that SEN support, ultimately, if it doesn't happen, then that law does fall to the local authority to provide. The other thing to note, I know there's a lot here, but the other thing to note is that an EHCP is not for children and young people that have only a disability. A child or young person has to have special educational needs to have an education, health and care plan. It is not for those that have purely a disability with no SEN. And there's some links there. So what is an education, health and care plan for the Council for Disabled Children, and some bits from the gov.uk. And EHCPs identify and describe the child or young person's education, health and social care needs, the additional support required to meet those needs, and the outcomes they want to achieve. So who needs an EHCP? Most children and young people with special educational needs will have extra help given to them without the need for an EHCP. And EHCPs are for children and young people who have special educational needs that cannot be met by the extra support that must be available in a mainstream setting. But, like I've just said, if that mainstream setting, whether it be a nursery, a school, or a post-16 placement, are still not providing that SEN support, the law is very clear that the responsibility falls and the duty falls to the local authority to provide it through that EHC needs assessment and that EHCP. As I said a minute ago, some children and young people may have such significant needs that an EHC needs assessment should not be delayed. So this is the content of an EHCP. So every EHCP must include these 12 sections, but each local authority can decide how to set these out. So for example, in Norfolk, our section I of an EHCP, which is the placement, is actually in section A. And it is jiggled around a little bit, but all these sections must be in there. Now, I don't know if anyone here is aware of the green paper, the SEND and AP green paper that came out. And there were some things in that green paper that have been discussed, and one of them is that there is going to be a template for EHCPs, a national template of what they're expected to look like, so that there is one EHCP. So if a child moves into a local authority, it looks the same. There is just one EHCP template. There are certain areas at the moment in England that are trialling these new changes that have come from the SEND and AP green paper. Norfolk is not one of them. In the eastern region, it is Bedford and Bedfordshire. They are the trialing out these, and they have currently the new EHCP that is being released, or hopefully will be released by the government, and it is something that has been significantly welcomed, having that template. So these are the sections of the EHCP. Please do have a look when you get these slides. And now we're going to talk about the 20-week process. The caveat I will add to this is that the EHCP process should be, if everything goes smoothly, 20 weeks, so 5 months. At the moment, not all EHCPs, EHC needs assessments, are being done within the 20-week process. I think in Norfolk, we're something like 52% are being done within the 20-week process. A question has just come in. When was the green paper? So the green paper came out. I think the green paper came out in 2021. And the green paper was supposed to be turned into white paper and then go through Parliament and have the law change. So it's supposed to make changes to the Children and Families Act, the Code of Practice, etc. But unfortunately, due to all of the changes within the government and the new prime ministers and all of the changes in the education secretary that we've had over the last couple of years, that never happened, and so there will no longer be any changes to legislation or law. What they are hoping is to tighten the guidance through the green paper, but have made it very clear that it is a guidance and it does not have to be stuck to. So make of that what you will. So the 20-week process. So weeks 1 to 6 is when. So once a parent, carer, child or young person submits an EHC needs assessment, or a school submits an EHC needs assessment, that kickstarts your 20-week process. Something we hear a lot as well is that schools will say, oh, it's better if you apply for the EHC needs assessment to the parent, or the parent will be told by someone else, well, it's better if the school applies. It absolutely makes no difference who applies for an EHC needs assessment, because ultimately the other party, whether it be the school or the parent, will be asked for their views and wishes and will be asked to fill in some forms within this weeks 1 to 6. So if the school apply and it goes through, the parent will be asked to provide their views and wishes, and if the parent applies for the EHC needs assessment, the school will be sent the document that they would have to fill in if they were applying for one, to fill in within this time. So it absolutely makes no difference whatsoever who applies for the EHC needs assessment. But time and time again, we hear schools telling parents to do it, or parents being told schools should do it because it gives them an edge, or it's better. It doesn't make a difference. The only thing that might make the difference is if schools are saying, yes, we will apply for it, and 6 months down the line, they still haven't done it because of capacity issues, at which point it would just be easier for the parent to do so, because the school then have to fill in the paperwork within this time frame. So within the weeks 1 to 6, the local authority will receive the EHC needs assessment request, which will have the parent, carer, child, young person views and wishes. A local authority panel will then take place, and they will review the evidence that's provided from the parent, carer and from the school, and decide whether they're going to conduct an EHC needs assessment or not. If the local authority agree to the needs assessment, they will notify the parent and it will move on to the next stage of the process. And if they choose not to conduct the needs assessment, then the parent, carer or young person has a right to appeal the decision. And we do have a refusal to assess and issue flowchart on our website, which you're more than happy to look at and signpost parent carers to. This bit is very much an overview. I'm going to go a little bit more in depth after these few slides into the processes and the legal tests. But I always find that a flowchart is really, really helpful when thinking about the 20-week process. So weeks 7 to 12, the local authority must gather the evidence from relevant professionals about the child or young person's education, health and care needs, and those professionals must then respond within 6 weeks. Once the local authority have gathered and reviewed the evidence, a panel will make a decision about whether the local authority are going to issue an EHCP or not. If they are going to issue an EHCP, the parent care will then move on to the next stage of the process. And if they're not going to issue an EHCP, within 16 weeks, They must tell the parent carer within 16 weeks of the EHC needs assessment request, and then they have a right to appeal that decision. Week 13 to 16, the local authority will start to write an EHCP based on the professional reports that were gathered in the EHC needs assessment, and these are done through EHCP coordinators in Norfolk. The local authority will then issue the parent carer or young person with a draft EHCP, and that parent carer or young person then has 15 calendar days to review the draft and respond with any changes they want made to it and what educational setting they want to be named in the plan. What we always advise parents to do is, if they are struggling to get it done within that 15 days or need longer, then if they ask the local authority for a meeting, a draft planning meeting, the local authority must comply. It's highly unlikely it's going to be done within those 15 calendar days. And so the local authority cannot finalise that draft plan until that planning meeting has happened. So if that planning meeting can't be organised for a month, that gives that parent a month to go through the draft EHCP. But if a parent doesn't respond within the 15 calendar days, or young person doesn't respond within the 15 calendar days, and doesn't ask for a planning meeting, the local authority have every right to finalise as soon as that 15 days is up, whether there are any comments or placements that have been asked for or anything, they have a right to finalise. Once the local authority have received the parent, carer or young person comments and preference, they must then consult with the school specified, and that school must respond within 15 days. At this stage, the local authority can also consult with other schools that it might deem as suitable as well. But they must consult with parental preference unless parental preference is an independent school. Week 17 to 20, the local authority will amend the EHCP with any changes it thinks necessary, including the name of the school, setting the child or young person is expected to attend, and any other changes that were asked for by the parent in other sections of the plan. Once the EHCP is finalised, the local authority must send a copy to the parent, carer or young person and the governing body of the school named in the plan. If that parent, carer or young person is unhappy with that EHCP, at that stage they then have a right to appeal that decision. I'm not going to get into appealing. That is literally like a 4-hour training session plus, really, so I'm not going to get into that. But we do have some recorded tribunal training on our website if anyone would like to have a look at what that process is. That comes very much from a parental perspective, though, rather than a professional perspective. So post 16, I'm not sure if anyone here in the room is working with anyone at post 16, but I thought it would be important to just include this information to make everyone aware. So when a child with SEND completes their compulsory education, they become a young person. And when they complete their young person, that is the last Friday in June of the year they turn 16. So for all of those that are in year 11 at the moment that have just conducted their GCSEs, the last Friday in June for them is next Friday, the 28th. So from the 28th of June, all of those in year 11 across Norfolk are no longer of compulsory education. Under the Children and Families Act, decisions that are normally made in relation to education by the parent carer transfers automatically to the young person at the ending of compulsory school age. So choosing where they want to go to college, choosing if they want an EHC needs assessment to be made, choosing what course they want to do, if they want to stay in education, those are all decisions that the young person will make once they are out of compulsory school age. The law does stress how important it is that young people take part as fully as possible in the decisions being made about them prior to post 16, as well, to encourage them to become ready for post 16, but it does also encourage that at post 16. If the young person lacks mental capacity, then the parent, carer or nominated person by the Court of Protection will continue to make those decisions for them. But the Mental Capacity Act is very clear that making an unwise decision or a decision that a parent, carer might see as a mistake does not mean that they don't have capacity or mental capacity. It just means that that they're allowed to make decisions and that parents might not agree with. So, for example, if a young person says, "I don't want to go into education, I've had enough, that's it, I'm done," that's that young person's decision. The parent has to respect that, even if the parent feels that that is a mistake, because they have the mental capacity to make that decision. There is a lot around mental capacity, so I've included some information there from IPSI and the legislation around mental capacity as well. But it is something that is quite a difficult subject for a lot of parent carers, that at post 16 they aren't allowed to make those decisions for their child or young person with SEN anymore. So it's something that has to be approached very carefully. Any questions at this point before we move on to the needs assessment? I can see Charlotte's been putting some bits in the chat, which is fantastic.
No worries, and you've literally just had a question come through.
Yeah, we have. Fantastic. So what if a local school is refusing to do an EHCP on any child until the child is in their last year before going to high school? I mean, that is absolutely, completely and utterly illegal. Something I've never heard of. It would be incredibly interesting to find out where that school is, if that school's in Norfolk. If you would be happy to let me know by emailing me. Oh, okay. Okay. But that is completely illegal. They cannot do that. Absolutely not. Because if a child or young person needs an EHC needs assessment and needs an EHCP in year 3 because their needs are such that they need an EHCP, then they absolutely have to apply for an EHCP. They've got a duty of care. They have a responsibility. So it's really, really important. They absolutely should not be holding off in applying for an EHCP. Yeah, that is nothing I've heard of before, but they absolutely should not be holding off on applying for an EHCP until the year before they go to high school. If they can evidence that that child needs a EHCP earlier than that. And what I would say to the parent is to apply for the EHC needs assessment themselves and get around it that way. Let the high school deal with it. Absolutely not. No, 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 no. Again, what we see is, especially that transition between primary and high school, a lot of children and young people with SEN are able to have their needs met at primary school because it is a smaller, classroom. It is more nurturing. They generally have one teacher for the whole year. They're in one class for the whole year. There isn't as much responsibility, that sort of thing. Once they get to high school, obviously it is a completely different beast. It's really big. It's far more children and young people than there is at primary. They're expected to go to different classrooms across the area. They're expected to speak to different teachers, do different things, and be more responsible. So, make sure they've got all the equipment they need, make sure they've got all their PE kit and books and everything. So it does become a lot scarier for our children and young people with SEN. And so that's why there is always a peak of applying for an EHC needs assessment in year 6 into high school. But it's also, the EHCP is a forward-looking document. And so actually, if a parent feels that their child's needs are not going to be met at high school, it should be applied for with enough time for that to be finalised, if it's all agreed, and go to the high school for them to start making those adjustments and put that provision in place. So I'm going to talk a little bit more now in depth about the EHC needs assessment. I'm going to try and whiz through it a little bit because I am conscious of the time, and couldn't think of the word there. Conscious of the time, and making sure we try and finish for 12. So what is the EHC needs assessment? The EHC needs assessment is a legal process carried out by the local authority. They aren't allowed to ask others to carry out any of the assessment. They must do so. So when a parent is applying for an EHCP, they are not applying for an EHCP, they're applying for an EHC needs assessment. That is the very first stage. This process is where the local authorities seek information and advice from a range of different professionals regarding the child or young person's needs, provision required, and outcomes. And what you will see that the primary person that they will go and seek that information and advice from is an educational psychologist, but it may also be a speech and language therapist, occupational therapist, clinical psychologist. The list is sort of endless, but the primary person that they will go to seek information around the EHC needs assessment is an educational psychologist. So who can request an EHC needs assessment? So parent carers of a child under 16, a young person between the age of 16 to 25, and the nursery school or college can all apply for an EHC needs assessment. Equally, anyone outside of those areas, so yourselves or a healthcare professional, can make a local authority aware that you are working with a child or young person that you believe may need an EHC needs assessment. But although you can't apply for one on the behalf of that child or young person, you can make the local authority aware. Local authorities will have their own forms that can be found on the Send Local Offer, and that is hyperlinked so that you can have a look at that. And look at the form that they need to fill in. Alternatively, if a parent doesn't want to fill in a form, they don't legally have to. They can literally just send a letter to the local authority requesting an EHC needs assessment, and there's a template on the IPSI website, a model letter that they can use. So that doesn't have to be a form. It can just be a letter that's sent to the SENOPs within the local authority. The EHC needs us, or just to go back a second, the model letter there, it is fantastic, but it advises sending the letter to the Director of Children's Services in NCC. Parents can do that, but the difficulty is that's not going to get to the SENOPS team very quickly. They are better to do a letter sending it straight to the SENOPS team, the SEN operational team in the local authority, rather than to the Director of Children's Services. So the EHC needs assessment legal threshold. So the local authority must carry out an EHC needs assessment if they are of the opinion that the child or young person has or may have special educational needs, and they may need special educational provision to be made through an EHCP. When we talk about the legal threshold for an EHC needs assessment, it's what we call a very low bar in law, and essentially most children and young people would fall under that category, because it doesn't say they have to have special educational needs. It says they have or may have special educational needs, and they may need special educational provision to be made in accordance with an EHCP. Essentially, a needs assessment needs to take place to prove whether that child or young person has got SEN and whether they need provision in accordance with an EHCP. Now, there are some local authorities who will never say no to an EHC needs assessment that comes through because they are aware of the legal test. Other local authorities will say no, and local authorities can have their own sort of criteria, but this is the legal test. They are not lawful. So saying you need 4 rounds of assess, plan, do review and an EdPsych report, which is the most common nationally, absolutely not. A parent carer can apply for an EHC needs assessment without any evidence because the law is so low. It's such a low bar. And essentially, the local authority have to make their decision based on the legal test and not the criteria that they put in place. And if a parent chooses to appeal that decision, and it then eventually goes to a tribunal, the tribunal will look at the legal test and not the local authority criteria. And at the moment, nationally, 97.5% of appeals that are being taken to tribunal around SEND and EHCPs, whether that's a refusal to assess, refusal to issue, or a final plan, 97.5% of those are being won by the parent carer or the young person. So it is considerable figures being found in favour of the parent carer or young person. So if the EHC needs assessment is agreed, information and advice will be gathered from the parent carer and a wide range of professionals, such as a healthcare professional, EdPsych professional, head teacher, SENCO, or social care. And a parent, carer, or young person can ask the local authority to seek advice from anyone within education, health, or social care, as long as it is a reasonable request. And that comes from the SEND regs. If continuing, if it's agreed, the local authority doesn't have to seek new advice if the advice has been provided previously. So, for example, if there is already an educational psychologist report that the school have applied for, and it has, they don't have to seek new advice, as long as that the advice is up to date, so around 2 years or under, and still reflects the needs of the child or young person. And if a parent, carer, young person has their own advice and report, such as a private ed psych report, and they can submit this to be part of the EHC needs assessment, and this evidence must be considered when the local authority is making its decision. If the EHC needs assessment is not agreed, to appeal the refusal to assess, the parent, carer, or young person must first consider mediation. And it's important that when attending mediation and or tribunal, the parent, carer, or young person gathers evidence that will help their arguments. And so that's a list of what that evidence might be. And I don't know if anyone in the room today will be supporting parent, carer through mediation or through appeals, but I always think it's really important to know this, that if you ever do have a family come to you that really need that support, you are able to give them this brief bit of information. Following mediation, if the decision isn't overturned, the parent, carer, or young person can then lodge an appeal to the first tier tribunal using the SEND 35A form below that needs to be filled in, and that's hyperlinked. Again, happy to do any more in-depth training around tribunals, mediation, etc., but I'm not going into that in great depth today because otherwise we will quite literally be here all day. Parent, carer, and children or young people involvements, the local authority must, and where it is a must, that's a must in law. They absolutely must do that. They must consult the parent, carer, child, or young person, and they must take into account their views, wishes, and feelings. They must engage the child or young person and parent in ensuring that they are able to participate in decisions and minimise disruption for the child, young person, and the family. So, for example, there is within the Children and Families Act and within the SEND regs and within the SEND Code of Practice, there is a golden thread that is that you only need to tell us once. So parent carers shouldn't have to tell their story to multiple different professionals. It should all be gathered once and used once by all professionals involved. SEND Reg 9 requires the local authority to consider whether the child's parent or the young person requires any information, advice, and support in order for them to take part effectively in the needs assessment, and if so, this must be provided, and that might be provided via us, SENDIASS, or it might be provided elsewhere. Any questions at that point? No? Hopefully you're still with me. I know this is a lot to take in, and it is very much an overview, but hopefully you're still with me, and hopefully you're getting some good information here. So decision not to issue an EHCP. So the legal test for issuing an EHCP is found within section 37(1) of the Children and Families Act, and it says, where in light of an EHC needs assessment happening, it is necessary for special educational provision to be made for child or young person in accordance with an EHCP. The local authority must secure that an EHCP is prepared, and once the EHCP is prepared, must maintain the plan. So this legal test is very, very different to the previous legal test for a needs assessment. So this is in whether they're going to issue. So the needs assessment has now taken place. It goes to a panel again, and they decide whether they're going to issue the EHCP. And this is the legal test that they must look at. So this means that the local authority must decide whether the evidence gathered during the needs assessment shows that it is necessary for the child or young person to have an EHCP. In this refusal to issue appeal, the burden of proof is on the parent, carer, or young person. In all other appeals related to an EHCP, the burden of proof is on the local authority. In this one, it's on the parent, carer, which means it's the parent, carer is the one who has to prove and show that an EHCP is necessary. And they will need to demonstrate through evidence. And there's a number of ways to do that. So have the setting spent over the notional 6,000? Has the setting done everything they can within the Ps document, which is the provision expected at SEND support? Could the setting provide the provision without an EHCP? If the child or young person were to move to another place of learning, is it likely that they'd be able to put the same support in place without an EHCP? EHCPs are forward-looking. Is it unlikely that the provision detailed in reports could be met in the next phase of education? So there is a lot of case law around this as well. And I won't get into too much detail, but the case law does make it very, very clear that if a primary setting, for example, or any setting is providing a significant amount of SEND support, they have got, 6,000 plus, let's say they're spending 15,000, they are providing a significant amount of SEND support. It's highly unlikely that that would be replicated should that child move, in which case an EHCP would be necessary. Just because they're receiving that support right now does not mean that it wouldn't be necessary for an EHCP should that child move to another phase of education or move away from that school. To appeal a refusal to issue, the parent first must consider mediation, same as the refusal to assess. And following mediation, if the decision isn't overturned, the parent, carer, or young person can then lodge an appeal to the first tier tribunal, and they'll need to fill in that SEND 35 form that's hyperlinked there. Draft EHCPs. So there is a lot to get through. Like I said, this is very much an overview. I could be here for hours talking to you about the intricacies and the in-depths and the case law and the law around EHCPs. This is very much an overview. So following the EHC needs assessment, if the local authority agree to issuing an EHCP, the parent, carer, or young person will receive a draft plan. Parent, carers, and young people have at least 15 days from the draft, and that's calendar days, remember, to review the plan and ask for any amendments to be made and inform the local authority what their preferred school is, and if they also want to ask the local authority to meet to discuss the plan. How to read a draft plan. So the content of the plan, so sections B, E, and F, will be based on the reports written by the professionals. So B is the needs, E is the outcome, and F is the provision. In a draft EHCP, section I will be blank, and that's very common, very normal, and that's because at that stage, that's when you ask for the school. We have a booklet on how to read and understand an EHCP, and it's hyperlinked at the bottom there, and I would really encourage all of you in the room to have a look at it and certainly signpost parents to it, because when they receive a draft EHCP, they only have 15 calendar days, and that booklet will talk them through what to look through and if their EHCP is suitable and it is correct. The needs and provision written into the EHCP should be specific and quantifiable. The outcome should be SMART, so specific, measurable, achievable, relevant, and time-bound. And woolly wording such as regular, maybe, opportunities for are not specific or quantifiable and should be avoided in plans. So, for example, if it says at direction of the child or young person, or at direction of the SENCO as well, there should never be anything. It should be the professional who quantifies and specifies. It should not be left up to the SENCO or the young person to quantify and specify what support it is that they need. Equally, with things like regular, you regularly brush your teeth twice a day and you regularly go to the dentist once a year. Regular will mean different things to different people and will also be different depending on the constraints of the place of learning. Equally, small groups, that's woolly wording, because a small group in a mainstream high school might be 15, but a small group in a specialist school might be 3, and so it does need to be quantified and specified. I'm not going to go into depth in that because, again, we do training on this, and we have got our tribunal training online that talks about this, but going through an EHCP could be a workshop for like 3 hours, so I'm not going to go into that in depth. So what is a need? This is again for everyone to be aware. A need is not a diagnosis, but the individual difficulty the child or young person has. A difficulty is something that hinders or prevents them from participating in or accessing learning. So, for example, pupil Y struggles to process and retain information. Pupil Z struggles to maintain peer relationships. The provision, SEP, is support that is additional to or different from that made generally for other children and young people of the same age. So again, if we go back where it says pupil Y struggles to process and retain information, the provision might be pupil Y needs a daily visual diary, 5 minutes of preparation time at the beginning of every lesson, supported by an allocated adult and a personalised learning plan, which will include same day over learning with allocated adult for 5-10-minute sessions a day. If we go back, pupil Z struggles to maintain peer relationships, and it says here, pupil Z will have access to a specialist evidence-based nurture programme for 30 minutes, 2 times a week, delivered by a trained member of staff. That's the level of specification and quantification we want to see in an EHCP. Outcomes are defined as the benefit or difference made to an individual because of a provision. Now, outcomes are a really, really important section of the EHCP, but they are not an appealable section of the EHCP. If a parent chooses to appeal a final plan, the only section they can appeal are B, which are the needs, F, which are the provision, and I, which is the placement. They cannot appeal the outcome section. But actually, the outcome section is so important, because this is the section that at the annual reviews will be looked at to see if they are meeting their outcomes. Outcomes should be specific, measurable, achievable, realistic, and time-bound, so they should be SMART, and they should articulate what should be achieved by the end of a phase or stage to move forward. So, for example, pupil Y will make half-termly progress with a national curriculum in a mixed ability class from his starting point so that he meets year 1 expectations by the end of year. Pupil Z will feel more confident in establishing and maintaining friendship. She'll feel able to discuss any issues with trained member of staff. So when you get these slides and you do have a look at those 3 slides back to back, because they do show what a need, provision, and outcome would look for the same, across the same sort of need. So following the parent, carer, or young person's representations, the local authority will either issue a final plan with all or some of the changes expressed, issue an unchanged final plan, make changes of their own, and reissue the plan in a draft form. If the local authority have no response within the 15 days, they can finalise the plan, and there is nothing in law that states the parent, carer, or young person has to sign off on the plan before it can be finalised. It can just be finalised. I'm aware there's a question, so I'm just going to have a quick look. So bear with me just a second. Can the school keep applying ongoing each year for extra funding even without an EHCP? Yes, absolutely. If that child needs an additional 4,000 every year, 5,000, 6,000, 10,000 every year from the local authority to be able to meet that child's academic needs and social, emotional, mental health needs, cognition and learning needs, all of those, whatever they might be, then absolutely they apply for it year on year to the local authority. They would need to show and prove why that child needs additional funding. So it's really, really important that there is a robust SEND support plan in place that shows the need, and also Norfolk County Council use something called INS and IPSEF, which is INS is a indicator of need for an individual child or young person, and an IPSEF is sort of the needs of the cohort of children and young people SEND in Norfolk. But again, I'm not going to go into that in great detail because I'd be here for a while. But yes, the answer to that question is a resounding yes. So final plan. So following the 15 days, the local authority will send the final EHCP, and it's important at that stage the parent, carer, and young people review the document to see if they're happy with it, and they're happy with the placement that's named in section I. If they aren't happy with sections B, F, or I, they can ask. They have a right to appeal that decision. If they are unhappy with any of those sections, and they are also unhappy with any of the health and social care sections, they can ask the tribunal to make a non-binding recommendation related to health and social care. But they cannot appeal health and social care without appealing one of the educational sections, which is B, F, and or I. They must consider mediation, and any appeal to the first tier tribunal must be lodged within 2 months of the decision letter from the local authority, or 1 month from the mediation certificate, whichever is later. And actually, something I didn't say is if a parent wants to appeal a refusal to assess, or a refusal to issue, or a final EHCP, they all have the same time frames, which is that 2 months from the decision letter, or 1 month from the mediation certificate, whichever is later. So, for example, if the decision letter from the local authority came in on the 12th of July, that means that parent has 2 months, so the 12th of September, in which to lodge their appeal to the tribunal. They must first consider mediation, unless it's Section I. Section I, they don't need to consider mediation, but all other sections, all other appeals must consider mediation. If they were then to receive their mediation certificate on the, 19th of July, that would give them a month to the 19th of August, but they've actually still got until the 12th of September in which to send in their paperwork. So that 2 months is what you would then look at. If the parent doesn't get the mediation certificate until the 11th of September and their 2 months runs out on the 12th of September, then that mediation certificate would then give them till the 11th of October in which to lodge their appeal. So it is quite complicated to explain, but essentially it's 2 months from the decision letter or 1 month from the mediation certificate, whichever is later. But it's really important that it is done within that time frame, because the tribunal then don't have to accept an appeal if it's out of that time frame. And equally, if it is a final EHCP, the parent would then have to go through the process of an annual review to get the right of appeal again. So annual review. So the annual review is a formal process looking at reviewing the EHCP and specifically the needs, provision and outcomes specified, as well as the placement. Is the placement still working? Is it still appropriate? And deciding whether these need to be amended, can remain the same, or the plan can be ceased. The responsibility for carrying out an annual review lies with the local authority, but in most cases they will delegate or the organisation of the review to the place of learning. But the review itself is not the meeting. The review is the process from start to finish, when the local authority make the school aware and the parent care aware of an annual review that needs to take place up until the decision letter. The meeting is just a small part of the annual review process and is the only part that can be delegated to the place of learning to do. An EHCP coordinator does not need to attend a review meeting in law, but coordinators should, where possible, prioritise attending emergency and phase review meetings.
Molly?
Oh, is that a question? Sorry. No? Okay, that's fine. I think somebody might have accidentally unmuted themselves, but that's fine. An EHCP must be reviewed at least once a year, and the first review of the plan must be held within 12 months of the plan being finalised. Any subsequent reviews must be held within 12 months of the previous review, and this is to ensure that the EHCP stays up to date and continues to provide the support the child or young person needs. The only difference to that is for children under 5, and in that case the review should take place every 6 months, and that's because children under 5 develop very quickly, things change very quickly for them, and so it needs to be reviewed every 6 months to make sure that the provision continues to be appropriate for them and is meeting their needs. But after 5, then it reverts to being annual, so yearly. So case law. So case law is, so when we talked about earlier on the sort of framework of law, and we talked about the SEND Code of Practice, the Children and Families Act and the SEND Regs, all of those are really important pieces of guidance and legislation and law, but within some of that there is grey areas open to interpretation from one person to another, and what comes from case law essentially comes from those grey areas. So where a parent carer or a professional challenges it to the upper tier tribunal and says, actually, this is very ambiguous, it's not very clear, there's no specific time frames, or it's open to interpretation, they will take it to the upper tier tribunal, they will make a decision, and that will become case law. That case law will then trump any and all of the Children and Families Act, Send Code of Practice, etc. So although it's still in the Children and Families Act, that case law supersedes it, and that is the decision of the tribunal. So there is a huge amount of case law that is out there around the ambiguities in the Children and Families Act, the Send regs, Send Code of Practice, because, I mean, between myself and my colleagues, we will have arguments about how we interpret the law differently to each person. And both of us are right, all of us are right, but we're also all wrong, because it's so hard to prove what the real meaning of it is when there's such ambiguity. So that's why there's case law. So I've hyperlinked the case law there for everyone to have a look, but this is in relation to our LMP versus Devon County Council from 2022. So this ruling was a landmark case, and it was done by a gentleman called Steve Broach, who is an absolutely incredible SEND solicitor. And if you don't follow him on Twitter and you've got an interest in this area, I really would, because he's fantastic. He was one of the people that was part of this landmark case. For years and years and years, we have been saying that around this, it is just too ambiguous. It is not specific enough. It is not helpful. And now, thankfully and finally, there has come some case law to challenge. So historically, following an annual review meeting, the local authority must send a decision letter within 4 weeks to the parent, carer or young person on what they propose to do. So maintain, amend or cease the EHCP. If the local authority chose to amend the EHCP, they would then have to issue an amended draft as soon as is practicable. But as there was no defined time frame, this phrase would be open to interpretation and could result in lengthy delays. So that as soon as is practicable, you would have some local authorities who would say, well, actually, it's going to take us a year to get you that amended EHCP. That for us is as soon as is practicable. But within that time frame, it meant that child was going without the correct and up-to-date appropriate support for another year. And then right around then, it comes out just as the next annual review was to take place. And that was actually really common practice. And ultimately, local authorities could get away with it because it says as soon as is practicable, and that was as soon as is practicable for them. So the High Court in this ruling found that there is a time frame in which LAs must complete the annual review. And so now, if the local authority decide to amend the EHCP following the review meeting, they must send the decision letter and the draft EHCP to parent, carers or young people within 4 weeks of the meeting. That then gives parent, carers and young people 15 days to provide comments. And the ruling made very clear that local authorities must send the parent or young person the final amended EHCP within a maximum of 12 weeks of the annual review meeting. So as soon as that annual review meeting happens, within 4 weeks, that parent, carer or young person must receive a decision letter. That decision letter says amend. 8 weeks after that, they must receive a final EHCP. So that is a real landmark ruling. It was really welcomed by lots in the SEND law profession. SENDIASSes were extremely happy about that nationally, as were IPSI, as were lots of other people. So it's a real fantastic landmark case. So support you could provide to someone that wants to apply for an EHC needs assessment. So this is not exhaustive. You will know the families that you're working with and the type of support that they will need and help that they will need in these processes. But what I have said is that from today's training, it would be really good for you to be able to refer back to the presentation and understand the process, where to go, what it looks like, and signpost parents and where to signpost parents to seek further support. But also knowing that it's a 20-week process, that you don't need a diagnosis to receive to get an EHCP or to receive any kind of additional support. Knowing what the legal tests are so that you can go to parents and say, actually, you have a right to appeal that decision, and this is the legal test around it. Support children, young people and parent carers to gather the views and wishes for the application. That's so important that that's done. Know the difference between SEN support and an EHC needs assessment, and where it's actually pushing the school to provide more support or whether it's the responsibility of the local authority. And also support the parent, carer or young person to speak with the place of learning if they need it. Ultimately, what I would say though is, if in doubt and you're not sure, or you think that parent's going to need more help than you are able to provide, please do signpost them to our service, signpost them to book an appointment on our helpline, and we can take it from there and escalate things if necessary to casework support or one-off support. But it's just knowing that we're out there and we can support if it gets to a stage where you're going to sort of struggle to be able to meet those needs of that parent, carer or that family, and they need more specialised support with the process. There's a list of supporting websites there, lots of information. Please do have a look at them. When I send this presentation out to Charlotte, you'll get it and you can press on the hyperlinks, so that's absolutely fine. Any questions or reflections? So I know that we're an hour and a half in and there's a lot of information that I've given, but if we stop the recording now, I want to give everyone enough chance and time to ask questions and for me to answer